The launch of the mental health service follows reforms, including the introduction of an outreach community service and supported transitional accommodation. The latest service is the introduction of a nurse-led liaison service operating 7 days a week from 8 in the morning till 8 in the evening. The Minister for Health said the recent appointments of psychiatrists, psychologists and counsellors had reduced waiting time for appointments with psychologists to 4 weeks, down from 8 weeks in September last year.
So as a result of all the reforms that we've made so far, the community will appreciate that we've increased services and we've increased the complement of mental health professionals. That means that, and this is something that I'm actually very worried about always, that the patient does not get lost in the system where we add more professionals and more processes around his or her care. So today's announcement is of a nurse-led liaison service. The nurses are experienced charge nurses in delivering mental health. It's a service that will be based in Ocean Views. It will be from 8 in the morning until 8 at night. And of course, the whole point of the liaison service is to try to remove attendances at St. Bernard's Hospital at A&E, and when patients and their families require mental health support, that they are able to do so at Ocean Views at this new liaison service. And that liaison service will also be able to arrange for our patients whether there is a need for appointments with psychiatrists or counsellors and or psychologists, and of course to help our patients navigate the new systems that we're putting in place. So we're very excited about this new reform.
Local mental health campaigners have called for a service that does away with the need to go to A&E in case of a mental health emergency. A nurse liaison based at Ocean Views will now be available to provide assessments, support and reassurance to both service users and families. The nurse will also provide advice and support to clinical staff based at St. Bernard's Hospital, who refer individuals to the appropriate mental health teams. The nurse liaisons are both highly qualified charge nurses experienced in mental health.